This is USVI News, your Virgin Islands connection.
Hi everyone, thanks for joining us for USVI News. I'm Emily Matson. This weekend we celebrate Emancipation Day here in the Territory, a day to commemorate the emancipation of slaves on the islands, which happened back on January 3rd, 1848. Many offices will be closed on Friday in observance of the public holiday. And this year's celebration will be unlike any other. Many are calling it the beginning of a new chapter for the U.S. Virgin Islands in its annual celebration of freedom from slavery. Our USVI News' Ali Bourne-Vanek has more, plus speaks to the VI resident who helped bring it all together.
The U.S. Virgin Islands Emancipation Day celebration this year will be different. Here in Emancipation Garden, it will be the first time celebrating freedom from slavery without the sculpture of Danish King Christian IX. It was removed earlier this year.
It's very important that people come out. We ask the Virgin Islands to come out this emancipation, because it's very important that this is the first celebration that we will have, 1848 celebration of emancipation with the King Christian bust removed from the Emancipation Garden.
Jason Meade Sr., known as the Conch Shell Man, reached out to the VI legislature last year about having the bust of King Christian removed. He says it was a collective community effort, advocating it be taken down.
We want the Emancipation Garden to be for freedom fighters like General Boudreaux and other freedom fighters. It could be the four queens. So I wrote the letter and Senator Mastex showed up. The bill had come forward. I went, I testified. The bill was signed, but along the others, it was a puzzle that put together. I can't forget the Pan-African group, LEAB and the Pan-African group, because we put a signature to pick up signatures. And March, this year, March, the 30th, 3-0, the statue was removed.
King Christian IX ruled well after the Emancipation Proclamation. However, many historians argue that oppression of people of color continued during his reign, and he was king during Fireburn and the riots on St. Croix in 1878. The plan is to replace King Christian with the conch shell blower for freedom.
We fought for freedom. We wasn't giving our freedom. We fight for freedom. So it's very important that what happened in St. Croix, 1848 in St. Croix, when at least 9,000 enslaved fought for the freedom and demand the freedom, and they get the freedom. So it's very important that we come out and celebrate every year at July 3rd, our freedom. USVI News, I'm doing this in the behalf of Ali.
There is something so magnificent about the sound of our conch shell. Thank you so much for that, Jason. And thank you for bringing more of that this Saturday as we celebrate our Emancipation Day.
In St. Thomas, Ali Bourne-Vanek, USVI News.
It'll be a great day indeed. Governor Albert Bryan Jr. wants to extend the territory's state of emergency. He sent proposed legislation this week to the legislature requesting a 90-day extension to the current state of emergency he proclaimed back in March of 2020 in response to the COVID-19 pandemic, of course. The current state of emergency extension is set to expire next week on Tuesday, July 6th. So Governor Bryan is requesting an extension to remain in effect until October 4th of this year. In a letter to Senate President Donna Frett-Gregory, he wrote, although the territory has managed to maintain lower levels of COVID-19 activity, given that the USVI is a major travel destination, it will continue to be threatened by the COVID-19 spread from external sources, and from places that have a higher risk profile. The territory, having already identified one new variant of COVID-19 in our community, will remain at risk as long as this virus remains rampant throughout the U.S. and the world. Extending the state of emergency for an additional 90 days or more will allow the territory to implement adequate staffing coverage, get medical supplies, continue to control measures for mitigating the risks of COVID-19, and continue the efficient operation of the vaccination program without interruption. This comes as vaccine initiatives continue here in the Virgin Islands, with about 46% of people here in the territory now fully vaccinated. 36,594 people are fully vaccinated with 2 doses, which is about 46% of the population. The Virgin Islands Department of Health has administered 44,357 first doses, which is about 56% of the population. But we did fall short of Governor Albert Bryan's goal of getting 50,000 VI residents vaccinated by July 1st. So while there have been 80,000 combined doses administered, more needs to be done to get folks vaccinated here. So Government House has hired more outreach workers and staff to try to get the message out to vaccinate and decrease vaccination hesitancy, especially in the age group of 16 to 49. You can get a vaccine at many pop-up events happening across the territory through private providers as well as community vaccination centers. To make an appointment to get a vaccine, just call 340-777-8227, or you can schedule it online at covid19usvi.com/vaccine. Anybody 12 years of age and older are eligible to get the Pfizer-BioNTech vaccine. Meanwhile, Johnson & Johnson says 2 studies show its coronavirus vaccine is effective against the Delta variant and offers protection for months. The company says it analyzed blood samples from 8 people who received the single-dose vaccine in the phase 3 study. According to the company, the vaccine created neutralizing antibodies against the Delta variant. Researchers also tested blood taken from 20 people who participated in an early trial. They found the immune response generated by the vaccine lasted at least 8 months and actually improved over time. So the pandemic is absolutely not over. That statement coming from the U.S. Surgeon General after new numbers show the concerning Delta variant is continuing to spread across the U.S. It's now detected in almost every U.S. state, although fortunately at last check, it has not been found yet here in the Virgin Islands.
It now accounts for 1 in 4 coronavirus cases in the U.S., and the Delta variant shows no signs of slowing down.
This variant of COVID is highly transmissible, the most transmissible that we've seen to date.
Top U.S. health officials say those who are fully vaccinated have a high degree of protection from the Delta variant, but
if you are not vaccinated, then you are in trouble.
Some of those unvaccinated are the youngest Americans. Right now, the FDA has only authorized the Pfizer vaccine for those as young as 12.
I would say right now, if your kids are old enough to wear masks, then they should when they're indoors, at least until we can get our arms around this Delta variant.
That variant is spreading in some areas more than others. Health experts say that means Americans need to fully understand the risks in their area.
If you're in the Northeast where transmission is really low, then your kids are a lot safer than in parts of the South Central U.S. right now where the epidemic is really taking off. That 1-2 punch of the Delta variant and low vaccination rates.
A new Kaiser Family Foundation poll suggests most U.S. adults who plan to get vaccinated against COVID-19 have already done so. 65% of adults surveyed said they've received at least 1 dose. That figure hasn't gone up much from 62% in May. About 14% said they will definitely not get vaccinated.
The more people we get vaccinated in our country, the fewer people will get infected.
So about 20% of people polled who have yet to get vaccinated said the main reason is because they believe the vaccine is too new. A smaller number of people in the survey cited other reasons like concerns about side effects or distrust in the government. Honduras receives 1.5 million doses of the Moderna COVID-19 vaccine from the United States. It's part of an initial delivery of doses through the COVAX International Vaccine Sharing Program. The shipment's part of 80 million U.S. doses that President Biden has pledged to share with other countries around the world, either directly or through the COVAX program. Last week, the White House laid out its plan to share 55 million of the pledged 80 million U.S. COVID-19 vaccine doses globally, with roughly 75% of the doses allocated to Latin America and the Caribbean, as well as Asia and Africa through the COVAX program.